Uh, what's up? You're putting pressure on me because there's little time. But hello, people large and small. My name is AJ. This is my partner, Mitchell Van Arnsdale, Andrew Shepard, and I am covering the causes of breast cancer. Now, actually, mankind does not know the actual cause of breast cancer, but researchers have found out some risk factors. As you can see here, there is age, diet, and hormones, family history, and environment. Family history. Now, okay, there's two things in this slide. Family history and age. So, we all know that the older the people get, the immune system will decrease. And that raises the possibility of having breast cancer. And so that's the age. Family history, this more aims towards, like, moms. If a woman has a mom or a daughter or a sister who has had breast cancer, that raises raises the possibility of them getting breast cancer. But also, darker skinned people, and I'm not trying to be racist, the darker skinned people have a higher chance of getting breast cancer than white people.
Be sensitive.
Hormones. The women with like a higher something, whatever, of estrogen have a higher chance of getting breast cancer because estrogen increases the rate of blood cells dividing, and that then raises the possibility of cells dying out, and then we all know that they turn into cancer cells, so yay. Breast cancer is not a laughing matter, but still. Diet. Obesity, alcohol, 2 bottles or more, and high fat. All three of those. High intake of alcohol, like more than 2 bottles a day, increases the risk, and also a poor diet and lack of exercise will do the same.
Are we talking bottles of wine or like bottles of beer?
Beer.
Okay.
Beer and love.
Not me.
Environment. You can't choose your parents, but you can control your lifestyle. Stay away from cancer-causing chemicals. And I had a list, but it somehow disappeared. Excessive radiation, sunlight, alcohol, of course, and then proper exercise and diet.
Yay!
That was mine.
Good job. Oh, wait, no. Put the team on your back.
Go, buddy. Guys, let's rock, paper, scissors. Oh.
Chemotherapy is a drug that uses powerful chemicals to kill cells that have damaged DNA. And chemotherapy can be administered through the vein, or a vein, injected into a body cavity, or delivered by a pill orally. Side effects of chemo can include nausea, fatigue, vomiting, and hair loss. Chemo damages the DNA of cells so they can't divide anymore. And there are 2 types of chemo. Cell cycle specific is when cells are only dividing, and cell cycle non-specific is when cells aren't dividing. And is chemo the best treatment? It depends on your specific case.
Okay.
Okay.
I'm so proud of you. So proud of you. I can see right now. I'm gonna get a bumper sticker that says
Buzz my case.
I can't drive.
Drew.
Where's your
Still, it's still disabled. It's got, you got 5 minutes to wait, and we don't have that time.
I'm surprised. AJ, you just went all out.
I know.
You good, man?
You know what Mitchell did? He disabled it himself. So he
Mitchell.
didn't do his
No, I
thing.
did. You sure? Oh yeah.
Just say,
Did you email them to Drew at all?
No, I haven't.
It's all
Everybody wants to
okay.
Because I emailed to his wrong one. I thought it was.